So let me introduce him. Dr. Danish Bhatti is a movement disorder neurologist and teaches physicians internationally. Dr. Bhatti has directed an online fellowship for movement disorder since 2017. He's a founding director of International Neurology Program at University of Nebraska Medical University. He received International Best Teachers Awards from Pakistan Society of Neurology Pakistan, and also he received an award on Impact in Education for Innovation Practices Award from Campus-Wide Award at UNMC. Dr. Bhatti participates in many multi-center trials, and also he works at UNO, including pharmacology and biometrics trials and things. Please welcome Danish Bhatti.
All right, thank you. So I'll try to convince you that our new technological way of learning are equally good and maybe better in some ways than the traditional method of learning. The traditional method of learning is what we call a seminar. Seminar is when I stand here and I tell you about something for half an hour, let's say subthalamic nucleus and its role in management of Parkinson's disease, which is my interest. And then I expect you to remember everything afterwards. That's the traditional method of learning. But I think we have enough technology to now make it so that the learning is flexible, learning is more effective, and we can measure how good or bad the learning is. So let's look at what's going on in the field of e-learning. So these are the top e-learning statistics from 2019. The global e-learning market has become $107 billion by 2015. That's how much money is being made just by online courses. And online courses are considered normal for people who do jobs like on freelancing. So if you hire someone to edit your podcast, edit your video, build like a monogram or logo for you, and if his resume says that he has done online courses to train for that, that's accepted as normal, and that's just fine. He doesn't have to go to a school to get a diploma or a degree to do those kind of jobs. So a lot of jobs are now accepting an online learning method. 77% of US companies are using online learning for on-job training. So you hired someone with a basic training that they had, but you want them to do a very specific job. So you do some additional modular training. So I, as a physician, has to do annual modular training requirement at University of Nebraska. That includes the University of Nebraska's policy on infection control, on disease modification, how to respond to a threat. If there is someone, an active shooter on the campus, what am I supposed to do? If there's a fire alarm, if there's a thunderstorm, what am I supposed to do? All of that is taught to me through these online modules by my university. So I do an annual about 10 to 15 hours of online training every year to keep updates with the new policy. And so US government is also spending all that money on it. 43% of US college students find the digital learning very helpful, very useful. So it's becoming a very norm there. We have an online learning system implemented at University of Nebraska for the last 20 years. We just updated it 2 years ago to Canvas. 49% of the students are using e-learning. 67% of organizations are offering mobile learning. So if I deploy a test for my medical students who are rotating with me or my residents, they can actually just do it on their cell phones. While they're waiting in the resident room or they're in a cafe or wherever, they don't have to do a paper test anymore, and they can do it wherever they want and whenever they want. So e-learning is becoming extremely successful and extremely common in the United States. So what is the cost of e-learning? How expensive it is? These are the US costs, as you can see, that $160,000 per year and $260,000 for initial setting up. Now, why do I put this money information there? It's because to realize how important somebody thinks it is, you can see it in the dollar amount. If a university in the United States is willing to spend $259,000 to establish a learning modular system, that tells you the university highly believes in it. And if the thing is really not liked by a lot, it does not have much of a demand, the numbers would have gone down. The numbers have gone up. You can see that these systems have become so expensive because they are so sought after. People want to spend that money in the United States because they think it's worth it. There is value in doing it. And, you know, of course, we don't have to spend that kind of money in Pakistan. We can build our own, definitely much more cheaper and affordably. So what is the biggest challenge in education that the online learning is trying to solve? Why online learning have become so effective? Is because of this revolution that started 30, 40 years ago, which is called evidence-based principles of learning. How do someone learn? What are the evidence of it? And how can you make it more effective? So initially the challenge was that how do we make every teacher very effective, right? There are some great teachers that everybody loves. People go to their lecture and they understand everything, they remember everything. And then there are other teachers where you go in and you come out and you're not any better. You still have to go back and read the books and figure out, okay, what was it being taught and how am I going to remember it? So the United States started thinking about how can we make every experience great, that any teacher that you walk in, do you get the same amount of effective learning, where that when you walk out of the room an hour later, you know the things that were being taught and you remembered them. And what they found was, in order to answer that question, you have to first answer, how do students learn? What are the rules or principles or evidence that decides that how the learning happens? So there are these 7 evidence-based principles that are considered the guidelines of learning for all institutions in the United States, including medical universities. And I picked the 3 in there. So number 2 that I picked was the way the students organize their knowledge. How they classify them, how they schedule them, how they tabulate them, is how they will apply that knowledge. The way they remember the classifications is how they will apply it. Another one that they said is the goal-directed, targeted feedback is important for learning. So let me explain that a little bit. In the old days, it used to be that you say that if you want to learn something, you have to do enough of it. So I went to my teacher once and I said, I want to learn fundoscopic examination. I want to see behind the eye in the retina and I'm not really good about it. And his recommendation was, well, go do 100 fundoscopies and then you will know how to do it, right? That was the concept. But what we have figured out is that it doesn't matter how many times you do fundoscopy. What matters is that every time that you do it, somebody can tell you what mistake you made. So it's the targeted feedback. And if you do targeted feedback, actually you can teach fundoscopies in 5 to 7 attempts. In 5 to 7 practices of fundoscopy are enough to teach, and you don't need 100, and 100 is only needed when you're giving yourself a feedback that this is how, oh, I did this wrong, or I did that wrong, and you may not figure it out for the 10 tries, or 15 tries, or even 20 tries. So the targeted feedback is the key to solve the issue. So quantity is not that important in learning. Quality is important in what feedback you're getting and who is pointing out the mistakes that you were making, which is necessary. So this is an example, right? This is a WhatsApp message somebody shared. So someone was prescribed a medication and he opened up and he tried taking it. He says, how do you take it? It says 1 teaspoon or one of it, but how should I mix it with water? And the answer was that you're eating the cotton above the pills, above the drug, and that's just the cotton. So if you don't give the right information, you just dispense the bottle to someone and say, take 1 spoon every day, and he opens it up and it's just cotton on the top. He starts eating it. That means that your instructions were wrong. It's not the patient's fault. It's the physician's fault of not giving the right instruction to the patient, right? And that's the problem we have in teaching. So if we teach how we were teaching all the time, we'll get the same results we have gotten every time, which were not bad, to be honest. I'm standing here from the old methods of learning, but I know it can be better. I know that rather than having 10 students great in the class, we can have 50 students great in the class if we can improve the methods of teaching that we have. So what is my examples and my interest? So I build these online courses which are blended with face-to-face learning. The online courses allow the students to take assignments on their time, to go back and review the lectures, to go back and take quizzes. And that gives me information in more details with these details analysis in terms of graphs and plots on how much time someone is spending. I can actually see that if someone watched a lecture, then there was a part of the lecture that was re-watched a few times. Now I know that that particular part of the lecture was a sticking point for the student. I can also see that how much time a student spent on a specific question. So if I ask them 10 questions to answer on MCQs, I can tell that this question number 7, everybody's getting wrong and everybody's spending 5 times more time on answering to that question. It may be that I didn't write the question right. Maybe I'm not asking them what I need to ask in terms of assessing what they need to answer. So this detailed analysis helps me give a targeted feedback. It allows more organization of the knowledge that the student needs in terms of learning, and then it allows the repetition that is required and a flexibility of self-learning. So I also do education online, and the power is in scalability. So I have a YouTube channel where I post videos. It started with this first video on the top, which was called a 5-minute neuro examination. And in 14 months, we have reached 1.5 million views of a 5-minute neuro examination. That shows you that how scalable this information is, that you can teach the right information by these kind of platforms to a very large number of students. So what I've done in Pakistan so far is that we started an online mini fellowship for a component of neurology called movement disorders. Movement disorders assessment of Parkinson's disease, of tremors, of chorea, dystonia, ataxia, balance problem. Very complicated subject, very hard to teach. It does not exist in Pakistan as a separate field or specialty. This is what I have been trained in. I have a fellowship in it, and I'm the program director for our own fellowship, associate program director. So I decided to build a program of 6 months to teach the neurology graduates of Pakistan extra additional training on this field of neurology because they did not have fellowship trained teachers available locally. And it has been highly successful. We have graduated 3 classes so far where we take neurologists, recent graduates, we teach them these additional skills by showing them videos, by giving them targeted feedback. So the fellows in this course, they do these video assessment, they write their plan, and then I give them targeted feedback on what they're missing on each of this video, what component is missing, and then the structure is organized for them, and then it has the flexibility of doing it any time of the day, at any speed that they want. We show at least a 30% improvement in their performance at the beginning, from the beginning towards the very end, and a certificate is given from University of Nebraska. I am also building many such courses. Most of these courses I'm building for my own residents and trainees. You know, we have 18 courses, short courses for our residents as they go through the training of neurology that they have to take as they're doing their training in addition to seeing their patients. So not just face-to-face didactics. So we have found this very successful. We have presented this at national forums, and this is becoming very normal in the United States in terms of teaching and education in their residency. This was the summary I wanted to present. Thank you so much for your attention.